Okay, so we're just going to talk about the chapter 11, Fundamental of Nursing Care. This chapter talk about the complementary and alternative medicine, shortly called CAM, complementary and alternative medicine. So if you ask me what is complementary and alternative medicine? So if you read this topic today, this is alternative medicine, mean you support a patient has a pain. If a patient has a pain, you should give them painkiller, or more specifically you can say the NSAID, or like a aspirin, right? But if we treat the pain, any medication except then aspirin or painkiller, like music therapy, massage therapy or massage therapy, whatever you like, or you can, if you give them relax therapy, this is alternative medicine. So alternative medicine describe any practice that actually aim to achieve the healing effect of medicine. I'm just recap it for you. Alternative medicine actually describe any practice that aim to achieve the healing effect of medicine, right? Healing effect of medicine. And this complementary medicine, or other name is called complementary and alternative. Some books say it is a complementary medicine. Some books say complementary and alternative medicine. Even some books say this is called integrated medicine, right? Or even some journal agree with you. It is called integrated medicine and holistic medicine, right? Different name, but same thing. So basically, this is the alternative way of practice medicine, but our main target, healing the disease process. So go some medical terminology related to alternative medicine. Some terminology related to CAM. CAM means complementary and alternative medicine. So what are the different branches of alternative medicine? One is called allopathic medicine, then alternative therapy, complementary therapy, and also holism or holistic therapy, and also integrative health care. I said integrative health care, right? So little explanation. The allopathic medicine means traditional or conventional medicine, that is practice in the Western country. And alternative therapy means therapy used instead of conventional therapy. So basically, or imagine a patient has a lower abdominal pain, but you do not have any antispasmodic like ASPA or NOSPA for the antispasmodic or lower abdominal pain medication. When you do not have anything, what we do? It's sometimes we okay, put some hot water in the bottle, then it put on the lower abdomen. So heat therapy, right? So this is the alternative way. Or if a baby is crying for a pain or fever, then what we do? We try to convince them. Like we pretend something, we make some sound, right? We talk to them. So we motivate their concentration from pain to others. This is also alternative therapies. Complementary therapy that used with conventional therapy basically. And here the relationship among the living things is called holistic therapy. And also integrative healthcare, the use of Western medicine and also alternative, complementary alternative therapy as a coordinate way. So this is the basic terminology. If we know, it is good, and at least we have to know some basic things for board exam. And also here is the emphasizing of complementary and alternative medicine. First of all, this is very unique of each individual interaction between mind, body, and spirit. So this alternative therapy main target, we have to interact between the mind, body, and spirit, and multiple factors as causes of illness and disease. Also, patient participation in the treatment or healing. So this one, so it is called emphasizing of complementary medicine. So what area we have to focus, right? For them, this is one. Okay, the some of the student came a little bit late. For them, I'm just sharing. This chapter is 11 about the alternative medicine. So here, then go the alternative therapy with complementary therapy. So what are the difference between compare and contrast alternative therapy and complementary therapy? Alternative therapy are used to instead of conventional therapy, and complementary therapy here, this therapy is used with conventional therapy. So again, what is conventional therapy? If you say conventional therapy means the therapy usually we use for the patient, like as a complement, conservative therapy for any kind of sickness, what usually we have to do. So complementary therapy, they say the therapy used with, but alternative therapy means therapy used instead of. Like I said, if a patient is constantly complain of pain, and you should try to motivate them by any other therapy like massage therapy, music therapy, relax therapy. So this one. So if the therapy and if the conventional therapy and other therapies side by side, this is complementary. And alternative therapy means that conventional therapy you have to stop and you have to move or switch other therapy, alternative therapy. Very simple. I think you are enough to understand. And here, then go next. Here something is integrative healthcare, right? What is integrative healthcare? The term used to describe the use of Western medicine and also complementary and alternative medicine in a coordinate way. And basically the integrative healthcare or integrative medicine, the fact is that the integrative approach is true holistic healthcare. Now talk about what is holistic healthcare. Holistic healthcare means the healthcare who that provide all of the physical therapy or spiritual therapy, psychological therapy, all therapy together, basically holistic therapy. And go next, they said the issues surrounding the use of complementary and alternative medicine. What are the issues? First of all, cost, right? Some if you have a good health insurance, it's fine, but if you do not have, some medication is too expensive, right? Then some people in the developing country, they're not able to buy. So they should choose the other option. So cost is important factor. Hmm. And also some access to get it them. So sometimes it is difficult to get, right? Access. Self-determination. Like I know someone, he never ever take any kind of pain medication. He thought pain medication is very harmful for his body. So most of the times he follow the alternative way. The other point I can say, like some people thought that garlic is good for the hypertension. So the person who had the hypertension and little bit phobia to the medicine, right? Then they took the garlic for a long time. So this is actually the self determination one point, and second point is if anybody is too panic to the pharmaceutical chemical, right? And also it is related to the cost or easy to get it. Personal touch, other one, it is actually personal motivation or self determination, is almost same things. And go next one, they said allopathic medicine. What usually we do, allopathic medicine is the way a patient has a hypertension, then doctor prescribe beta blocker, atenolol or propanolol. It is actually allopathic medicine. And same way, if a patient has a um, cholesterol is high and doctor prescribe the simvastatin, right? So this simvastatin is allopathic medicine. This simvastatin is allopathic medicine. And so I said, just let me take your percentage. So okay. Okay, so allopathic, also known as Western medicine or traditional medicine or conventional medicine. So, first of all, the allopathic medicine, other name of allopathic medicine called Western medicine, traditional medicine, or conventional medicine, right? Same thing is one same things but different name. Hmm? So it is allopathic medicine. So example, I said a patient has a high cholesterol and healthcare provider prescribed the simvastatin, right? Or statin or levostatin. Hypertensive patient is prescribed the calcium channel blocker or beta blocker like atenolol, propanolol, or losartan, all of actually Western medicine or traditional medicine. So allopathic medicine refer to the treatment of disease. Also, health seen as the absence of disease, pain, or other simple or symptom of illness. Mind and body seems are separate. Mind and body seen as separate. So keep it mind here. Body means our normal physiology of the body. Physiology, I said, not anatomy. Hmm? Physiology means the what the normal function of the body, right? But anatomy means total tissue structure, all of the anatomy, structural anatomy basically. And mind means basically it is psychology, and psychology related with our central nervous system. If we talk about the science, so mind actually combination of the brain, and brain is combined with the central nervous system and peripheral nervous system combination, right? So now go next is called Eastern medicine, right? Not Western. Western medicine is allopathic medicine or traditional medicine or conventional medicine. Eastern medicine basically Chinese medicine, China again. So refer to the practice from places such as Asia or India. Basically, when we talk about the Asia, most biggest country in Asia is that China and India, and also Middle East. Middle East actually combination of some countries. And use of bioenergy is very important. Okay, sometimes it's called the Ayurvedic medicine, right? Their medicine collected from different kind of plants origin. Illness and disease viewed as a disharmony or imbalance or defect of energy in the body. Symptoms are the sign of body is trying to heal itself but need the help. So basically, I said the Eastern medicine collected from the plants origin, and also they call the use of the one of the terms called bio, right? Bioenergy. Bio means biology, right? Or bio means related to the life. So it is actually the um, the science which is dealing on medicine with the dealings with the life, okay, and collected from the plants. And here the possible cause of illness, possible cause of illness is here anything that is interfere with the balance and movement of bioenergy, and also including the diet, genetic makeup, lifestyle, trauma, negative thought, stress, and environmental toxic. So, not only the Eastern medicine, the health is absolutely related with all of the factor like diet, right? If anybody every day take too much fat, definitely the chance of develop of atherosclerosis. Hmm? Sometimes some of the disease is transmitted from generation to generation. I'm just talking about the genetic disease. Disease transmitted through the gene, like Huntington chorea from grandfather, then father and grandson. So genetic is transmitted family to family. And lifestyle support, if we do the sedentary lifestyle, we do not do the physical exercise, so lifestyle also important factor to develop the some of the disease like cardiovascular problem, like metabolic disorder. I think metabolic disorder mean diabetic mellitus, most common one. And also trauma is important factor of the develop of the disease. If anybody all the time talking the negative, right, we have to stop to thinking negative way, because this negative factor also influence our psychological health. Some stress actually is silent killer. The stress causes diabetes. Stress causes the hypertension. Stress causes the cardiac problem, cardiac disease, heart failure. So we have to stop the stress, or we should know how to deal with the stress. Always keep in mind, don't give the scope. Stress should control your life. You should control your stress. And also the environmental toxicity or toxin has important role to play and develop the disease. So an example, the farmer who work in the field, and they also dealing with some chemical substance, and this chemical substance is not good for their health. The also the farmer who work in the field, the chance of develop the lungs disease is environmental. The person who work in the leather company, they have a chance to develop the bladder cancer. So environment is important factor also. So now 5 most popular type of alternative therapy or complementary and alternative medicine. One is called cryopractice, right? Cryopractice. It is in United States. There's so many cryopractitioner. Massage therapy, another. Acupuncture. Okay. So acupuncture therapy actually most popular in the Chinese and also in Asia. So they just try to stimulate the nerve ending in the body, They thought if you massage in the nerve ending, you can motivate or stimulate the total central nervous system and patient should be cured. Some people believe it, someone. And also herbal medication. So herbs, or shortly called is the herbs or herbal. So medication is alternative medication. Some are good, some are not good, right? And other point is as a basically I said as a allopathic medic person, we do not 100% believe that herbs is always good. Basically, some of the herbs is really bad for your kidney. They causes the kidney shutdown, right? And some people believe in yoga, and if you do practice everyday yoga, and you should be get a better health, right? It's very good things. So go next, and here showing the fact of cryopractor. So this is actually a basic talk about the cryopractice. Support this act. This is the art of science, and also the manipulation of the pain to relieve the pressure of the nerve. And the nervous system plays an important role in the health and disease. Yes, it is. So the central nervous system, most important factor to play the disease. And also the natural method of health care are preferable to invasive treatment to use of the drugs. But all the time it's not possible, right? Keep in mind, invasive treatment, invasive, while there is a non-invasive. This invasive and non-invasive terminology used in several medical fields, like invasive surgical procedure, non-invasive surgical procedure. If I talk about if a patient give a medication and patient is cured because of medicine, like a tablet or capsule, the other patient do not take any kind of medicine, like I said capsule or tablet, but they took alternative medicine like a massage therapy. So this massage therapy for this patient is called non-invasive treatment. But the patient who took the medicine like tablet, I can say this patient took the invasive treatment, right? So this invasive and non-invasive, when you read the sentence, is very important how you have to read, because this word is sometimes changed. And here the massage therapy, like I think you know very well about this one, applying the pressure and also the friction, and also we have to give the pressure and patient is feel relaxed and press out in the muscle ending and patient feel good, and relax the music and decrease the stress. So basically when massage therapy do, and they also like to follow some music therapy. So the music sometimes good for our brain, and slow low frequency music actually touch the brain to work or reduce the stress. And here the type of massage therapy, I think I do not need to explain everything. You are good enough to understand. This is called Swedish, then reflectory, deep tissue massage, then go for the acupuncture therapy. Acupuncture therapy, I said already, the uh, so acupuncture therapy is, just give me few minutes. One student, she uh, miss our class, so like I have to invite her again. So she's calling. So okay, so this is the acupuncture therapist. So this said the practice of inserting the fine needle into the carefully selected point and located along the Mediterranean's or energy pathway of the body. So and means the person who is very skilled in acupuncture therapy, they can find out what are the nerve ending point in the body. They try to stimulate the nerve ending, stimulate the body healing abilities and correct the dysfunction, and treat the post-operative and chemo induce the nausea and vomiting, nausea with the pregnancy and post-operative dental pain. And here the popular herbal and their uses, popular herbal and their uses. So before to go, the popular herbals or uses, I'm just going to, this is the most important part of the, for the NCLEX board exam. Before to go, I'm just, I have to post something in our group because somebody is still missing. Let me come. Okay, so okay, so popular herbals, okay, and I told you this is the most important, and I'm just showing you different page with you, so you can easily understand. And in the NCLEX board exam, due to some unknown reason, they like the herbals, okay, and most important for our exam. So let me share something. I think I have to go here. Okay. Okay. Could you see this one? The herbal medication and medical implementation, right? So this is the list, the name of herbal medicine, and this is the medical uses or implementation or indication. So most popular is called aloe vera, okay, or aloe vera. Aloe vera basically we use as an anti-inflammatory medication for burn, okay, basically we use for the burn, or any times we can use for abrasion or help to heal the tissue. So aloe vera basically, if ingested, may cause the GIT upset or may increase the
There is nothing
detoxin.
show up.
What?
We cannot see nothing.
Oh, okay. So you cannot see nothing. So let me, okay, so here it is. Okay, here. Okay, can you see that right now?
Yes, thank you.
So this is the aloe vera, and these pages I'm going to email you after our Zoom session. So aloe vera, I said the indication may increase the decoction level. So aloe vera has an anti-inflammatory effect, right? But keep in mind, when we give or when the patient take aloe vera, we have to make sure patient do not take the cardiac medication digoxin, because when aloe vera and digoxin together, the digoxin level go up. Hmm? Very important for our exam. And these pages again, most important for our NCLEX board exam. And I got question from these pages, and I believe it is any student from NCLEX board repeat this type of question. And second one is called uh, um, Echeria, okay, or Echeneria. So this is a blood purify that is fight against the cold or infection. So the echinacea avoid with the or contraindication in the breastfeeding. So the mother who giving the breastfeed to the baby, they are not the ideal candidate for echinacea, right? Second one is called ginger or ginseng. Ginseng, this is actually Chinese. So ginseng basically we use for benign prostatic hypertrophy or BPH, benign enlargement of prostate for the man. We use the ginseng. Ginseng also used for hypertension or anemia. Keep in mind, we have to avoid the ginseng with coumadin, right? Coumadin is a blood thinner. If anybody or any patient to take the blood thinner like warfarin, heparin, or coumadin, they are not ideal candidate to use the ginseng, right? And also we have to hold for 7 days before any kind of surgical operation. We have to hold it. Second, this one is called St. John's wort. St. John's wort. So St. John's wort we basically use for depression, we use for menstrual disorder, but basically St. John's wort we use for depression. But keep in mind, if your patient took the St. John's wort, they has to avoid the sunlight because they causes the photosensitivity. They should avoid the sunlight. Avoid the food containing the thiamine. So thiamine containing food and St. John's wort is not good to eat together. So what is, if you ask me, what is thiamine containing food? The example is like avocado, banana, right? So all cheese containing food, okay? So also decrease the effect of coumadin. So again, if your patient take the blood thinner like coumadin, it is not good to tell them to take the St. John wort. This is the herbal medication. Go next. This is called kava kava. So kava kava used for decrease the anxiety and stress. They increase the effect of barbiturate. Barbiturate basically antipsychotic medication. If anybody take the barbiturate, tell them if they took the kava kava, the effect of barbiturate should be increased. Antipsychotic drug, barbiturate. Then ginkgo biloba. So ginkgo biloba. Some in my school, one of the students I know, she took the ginkgo biloba, and she do get the high score in 2 exams. Then all of the class thought she's taking this medicine, so she got the highest number. Then everybody started the ginkgo. I mean, this medication. So some people believe this is heal for the memory. improve the blood circulation, improve the attention span. So you should read more and more if you drink this or eat this one. But I do not know any evidence-based medicine support this one. Maybe or may not. And again, if patient take the Coumadin or blood thinner, it is not good. Tell them to this biloba and Coumadin together because increase the bleeding tendency, right? And also increase the effect of monoamine oxide inhibitor, which is called the dilantin. Again, if patient is go for the bleeding, I mean surgical operation, we have to hold this herbs medication because increase the bleeding. Most popular one we use this called ginger and garlic, right? Ginger basically reduce the morning sickness and also nausea and used to treat of the burn. So ginger, what we use. So may cause the central nervous depression or cardiac arrhythmia. What are the most important we have to know for NCLEX board exam? If patient has to take the blood thinner like warfarin or heparin or Coumadin, tell them not to take the ginger together. Then another one is called garlic. So garlic may decrease the cholesterol, blood pressure, and glucose level. So the person who take the raw garlic for a long time, their blood cholesterol going down, their blood pressure goes down, blood glucose level goes down. And this medication garlic again, if patient already have diabetic, they should avoid. If patient should take the blood thinner like Coumadin, they should avoid because bleeding tendency. Same as if patient go for the surgical operation, they has to hold it. The saw palmetto. This is the question I got in my exam. So saw palmetto basically is supposed to the health of prostate and improve the urine flow. So the person who has the benign enlargement of prostate, the saw palmetto help them. The saw palmetto also help to prevent the hair loss. I know one person who do not have any hair at the home, totally alopecia. He took lifelong saw palmetto, but no hair is growth. So unfortunately, so saw palmetto prevent the hair loss and no drug interaction is good. And then Valerian root. This is most important for board exam. Valerian root. So Valerian root basically promote the sleep, used for the headache, anxiety, and nervousness. May increase the sedation with alcohol. So alcohol or antipsychotic medication like barbiturate, not to give them together. Even benzodiazepam. Next, last three, black horse. Black horse used to the menstrual or menopausal syndrome, and also used for sedative or diuretics to reduce the blood pressure or hot flush or night sweat, and contraindication if the patient has chronic heart failure or pregnancy. So the mother who is going to get pregnant or going to deliver the baby, they're not the good candidate for black horse. Then feverfew, this is used for migraine headache or arthritis. Increase the effect of Coumadin, feverfew. And last one from here, this is called the licorice. Licorice used for the peptic ulcer, GERD, gastroesophageal reflux disorder. And contraindication, the heart disease. If a patient has a heart disease, the licorice is not a good thing. So basically I said if you ask me what actually need to know for the board exam, if I said only one or only two, we have to know each area. We have to know St. John's wort, they use for depression, and St. John wort not good to take with blood thinner. Then go ginkgo biloba, avoid the coumadin, then ginger, increase the bleeding, not good for coumadin, and but garlic reduce the cholesterol, blood pressure, and blood glucose level. Avoid the patient who have the diabetic. Then saw palmetto is good for the benign enlargement of prostate. Then Valerian root, frequently asking board question. Increase the sedation, right? When used with alcohol or antipsychotic medication like barbiturate, sleeping pill, and benzodiazepam. Valerian root, basically patient use for sleeping, promote the sleeping. Frequently asking question in NCLEX. Black horse, less important. Fear few, increase the effect of coumadin. So the most important message from this note for NCLEX board exam, just try to follow me, please. The herbal medication started by Z, I like ginkgo, ginger, garlic. The herbal medication started by Z, like ginseng, all interact with the blood thinner. Again, the herbal medication started with G, like ginseng or ginkgo or ginger or garlic. All of them interact with blood thinner, warfarin, coumadin, or heparin. So if patient should take the blood thinner, tell them not to take herbal what is started by G, like ginger, ginkgo, or garlic. Okay. Another most important point here, if you want to make it short and but you need the license, only try to remember the herbal medication that is interact with the blood thinner, like St. John's wort. St. John's wort interact with the blood thinner, decrease the effect of coumadin, right? So if you again go here, this is garlic, interact with the blood thinner. So again here, so I said like black horse, interact with this. So this is the most important point, and also I marked here. So when you go through, just focus up there. So I'm just going to go back in our main PowerPoint. And I said after my class, I will email you these pages. So I'm just stop it here and again going the main PowerPoint for today. Okay, so go back, go from here. So this one. Okay, so this is the popular herbals and their uses, right? What we finish in one pages, everything is same here, like aloe vera, like Echeria, feverfew, garlic. Okay, shortly. Some of the students like this one is okay. What is work with you? Just follow this one. It's not that mandatory. You should follow me always. No need. And popular herbal centenarios like ginger, ginkgo, ginseng, St. John's wort, saw palmetto, soya, and valerian. Ginger used for nausea and vomiting. Ginkgo used for memory enhancement, means help to memorize things. Ginseng, cholesterol and heart, good for this, cholesterol and heart. St. John's wort used for a antidepressant. Saw palmetto, good for the prostate. And soya, reduce the cholesterol. And valerian, it is good for insomnia, means they promote the sleep. And here the pregnancy, this is very important, this phase. Okay, This PowerPoint, basically this herbal portion is so important for our NCLEX board exam. The mother who is continue the pregnancy, it is good, do not take this kind of herbal medication like St. John's wort or ginger or kava, right? Or echinacea. So I said again, the pregnant mother better not to take the echinacea, St. John's wort, ginger, kava, right? So you have to remember, very important for board exam. Now, very easy things, yoga, everybody know that. So yoga definition, this is mild body intervention that used to breathing exercise, physical position or posture, and also meditation to decrease the stress. So if you start the yoga and your yoga master will say, take a deep breath like this, right? Take a deep breath, breathing exercise, or some posture is actually increase the blood supply, and also relax technique is called meditation can help you. So yoga basically good to reduce the blood pressure or improve the flexibility of the body, help to increase the concentration, right? And also help for better sleep and digestion. Basically, this posture help you. And some additional type of complementary and alternative medicine. So the student who joined with us little bit late, at the first PowerPoint, we talk about what it is. We already done. So what are the different type of alternative medicine? One is called aromatherapy, meditation, relaxation therapy, then play therapy, music therapy, then pet therapy, phytonutrient, and therapeutic touch or healing touch. So basically, if I do not know you have this experience or not, some people can hypnotizing power. So if they touch you, you feel good, right? This is called um, therapeutic touch or healing touch or hypnotizing touch. Most of the times we believe these people is very holistic. So now go the next here. So this one, the some aspect of alternative therapy, lifestyle change can reverse the disease, and also adapting the health lifestyle and eating whole food that is have not been processed, or they can prevent the disease basically, right? Not processed food, not contain too much salt or preservatives. So lifestyle is important component to prevent the disease. If you have a good lifestyle, if you avoid the sedentary lifestyle, if you do the physical exercise, they can protect us from the disease. So also, so now nursing care of the patient who using the alternative medicine. So some allopathic medicine, like you, like me, like us, who deal with the medicine, Western medicine who like it, usually we have a negative attitude, or we have again the herbals or some alternative medicine. But whatever, if patient like, we have to respect their choice, right? Like someone, one of you yesterday, one of you said she is feel good to take as if she took aspirin. So if she good feel to take aspirin, so why not you should respect them, right? If it is not that much harmful, okay? So I said some of the patient and medication related to their mental setting, right? So we have to respect what patient like. So also ask the alternative medicine what they use. Is it just non judgmental. Is it anything is illegal, right? So if it is not illegal, what a problem. If I feel good, so record any information regarding. So if you know this herbs or alternative medicine is really bad, like the kaba kaba is not good during the pregnancy. Saint John's wort is not good during the pregnancy, right? It's bad for the baby. So you have to tell the mother it is not good for them, right? It is your accountability. You should be tell the truth for the patient, and then it depends up to the patient what they like, they do, right? Use the patient teaching about these medications, good effect and bad effect, and every material, I mean especially the this type of, has a good effect and bad effect together. But as a healthcare provider, you have to tell your patient what is good or what is bad. Then actually up to this the basic lecture for today. And here same thing, I said every PowerPoint or the last ending is the same things. I'm not go through again. Information in the correction feature, all of this I went to several times. So basically this PowerPoint related to the alternative medicine, okay? And the pages I'm going to give you, okay? The herbal medication, or this is the most important for board exam. Do you have any question